So welcome everybody to the 3Shape TRIOS scan path strategy for partially and fully edentulous scanning. It is a webinar on training being presented by our very own Brenda Kirkin and Bannister Poe. And with that, I get to recognize the lead panelist here who supports both Brenda and Bannister, and that is Kelly Bevington, our Director of iOS Clinical Training. Take it away, Kelly.
Thanks so much, Jessica. Appreciate it. And thank you everyone for being here this evening. We know that you have many choices in education, and we are honored that you're choosing to spend an hour of your evening with us. So I'm going to be managing the question, answer, and chat box. Please feel free to throw ideas and questions out there, and I'll prompt them off to Brenda and Bannister as they come in. So we're super thrilled to have both Ben and Brenda on the iOS clinical training team. Honored the team is encompassed by dental professionals, right? So we're clinically trained dental professionals. Brenda comes to us from the University of Detroit at Mercy, and she is a certified dental assistant and a registered dental assistant, has been in private practice as well for over 20 years. And TRIOS, Dentsply Sirona products, and iTero are her scanners of specialty. And she covers the Midwest region for us, residing in Michigan. And then we have Bannister Poe, and Ben is a dentist from the Philippines. Ben comes to us from 3Shape, which is the manufacturing company of TRIOS, and prior to that was with Nobel Biocare, specifically with implants. And so Ben is a wealth of knowledge when it comes to anything TRIOS related, is also with implants and Medit and iTero and other scanners as well. So thank you to both of you for being here this evening. And we're going to do a combination of a little bit of PowerPoint so we can start moving forward with the PowerPoint slides. And then Ben's going to conduct an actual scan as well with our typodont and wash impressions and so forth. So take it away, Brenda.
Thank you so much for joining us. Just as Kelly said, here's some of our housekeeping that they've gone over. And I'm going to go do our disclosure. All of us trainers, we are full-time employees of NDX Lab. So I need to put that out there. And today we are doing the TRIOS workflow for partially and fully edentulous scanning. And as Kelly said, you know, Bannister, he will be doing the hands-on portion with the TRIOS scanner, and I will be doing more of like the lecture. I'm going to go over like different case scenarios, but wanted to let you know about our lab. We are the nation's leading dental lab network. What does that mean to you? As you can see, we are all over US, and so any of your laboratory needs, we can help you. And full service lab, just like I said, and we employ over 4,000 dental lab employees around the globe. And I know that Kelly introduced everybody. So there's Kelly, Brittany, myself, and Bannister. So we're going to get into talking about edentulous scanning. It is, to begin with, it can be a little upsetting because if you're used to scanning for a crown, it takes a little bit longer to begin with, but once you get the scan path protocol and you get it down, then you will be able to go away with it. Sometimes it is hard to scan in the mouth, and you may want to scan an existing denture, and you can do that. And you can also do a wash on an existing denture, and you can scan that also. And if you have an edentulous case that you did maybe an immediate denture and it has healed and you have a chairside reline and it fits really great, you love the suction, you can also scan that. I find that if you're using a wash, if you use more blue or green light and heavy body, it scans easier. So you want to begin on the lower, you want to start on one side and you want to have it angled a little bit lingually and occlusally, and you want to come around. And you want to be slow and methodical, not quick like you normally do for crown and bridge. And to begin with, you may have to rock a little bit so you can capture all the areas. For if you did like a wash on a lower, and if they have a lot of ridge, sometimes trying to get the scanner in that section where your ridge is on the impression, it takes a little bit of manipulating of the scanner head to get into the lower area to fill it in. And what you just do is you just hang out for a little bit and then move until it patches in, and then you keep doing that. So it is a little tricky to begin with, but once you get it down, just don't give up. Just keep going at it. I know that you'll be able to get it down, right? So after you get done moving it, then you can go and roll along the vestibule and capture the images that you need. And right here tells you then you rotate to the face and the lingual side and the slope of the ridge. I find it easier to scan a wash impression than an edentulous area, especially if they have had a denture for a long time and they don't have the landmarks like the reggae. You can still do it, but you're going to have to go a little bit slower and just take your time. But just don't give up, is what I'm trying to say on that. But I know that Bannister will be able to show you here shortly with the actual scanning on the scan path. And there is on your TRIOS an area where you can have a learning center, and it can go over all this information with you also. If you forget a little step, you can always go back to that to look. But it's different than going all the way around like you normally would for a full mouth scan. You want to come halfway, come across the midline, lift it up, go to the opposite side, and then roll around again and pass the midline, and then roll over and then back. So it's like putting a puzzle together, right? Do we have any questions so far? And what I like to do after I capture it, I like to look at it in the model form. So I will look to make sure I have everything captured and no holes. And if you have holes, you can just fill it in a little bit. And we've come such a long way with scanning. So you will get it down. And then here's the maxillary full edentulous scanning. And I will have to say, for me, sometimes I do the scan path. Sometimes it doesn't work the way that you want to. And you just have to just rock it a little bit, because every patient's different, right? Every mouth is different. If it's a case that you just did for immediate denture, they have a lot of landmarks, right? Because they have all those extraction sites. And on the maxillary fully edentulous part, you just start at the tuberosity and you do want to make sure when you come to the palate that you do get not only the soft tissue, but you want to get that post-dam area, because that's very important for the suction. And then it shows here, once again, like how you scan the palate. But I sometimes find that it's easier for me to go after I come to the lingual of it. I just keep patching it in. It's almost like painting is what I call it. And I find that scan path easier for myself. And if you have the little holes, then you can just go over and scan those. And then you want to make sure that you have all the anatomical landmarks. And sometimes it is a little bit difficult because the wand head, and when you displace your lip, you can lose some of that suction. So, but it makes a great, you can always make a custom tray with that and do a wash. That way you can capture more of the vestibule. And Minister will go through, like, there's different options, how to retrofit your partials. You're going to want to scan first for a pre-op scan with the partial out of the mouth, scan, prep the tooth, put the partial back in, pre-scan that, and then you can go ahead and then scan your prep teeth. And then you follow the protocol that you normally would for your crown preps. And I'm going to leave that and give that to Benister.
Hi, good evening, everyone. Let me just share my screen. Okay, so we're going to start with the choosing the patient or creating a case for a patient. So if there's any existing patient, we can just type and search it and click it, add a new case. And over here, there's a scan and send. So you choose the laboratory where you want to send your case. For this case, I'll choose the Yankee, DSG, NDX Yankee. So once I'm into the RX form, this is like a tutorial, especially right now that 3Shape has the new version of the software, which is the where you could it's linked all together. So you can always put a check mark over here, and so that it's not going to show again. So what we're going to do is try to scan a removable. I'll choose the full denture. And then I'll choose the which upper or lower, and then choose the material of choice. If it's printed or milled, I'll choose the milled for now. And then don't forget the delivery date. So you have to ask your laboratory. Usually it's like 10 to 14 business days. But there's some times that they could have they could deliver it much faster. So you have to coordinate it with your laboratory. And then we're going to save the choices. And then we're going to click next. Okay, so normally you need to preheat the scanner, but in this case, we're just going to jump into it. You can start scanning when it's about like 75%. The scanning is, the heat is to prevent fogging on the mirror. As long as if the patient is not breathing through their mouth, you can start scanning. In this case, we're going to be scanning the model. So I'll start scanning the model. I'll start with the lower. Check on the model that I scanned, and you can also use your scanner, the one, raise it up, press and hold the power button, raise it up, and then you can inspect the model. Once you're done, you press again the power button, and then if you want to move forward to scan the upper, I'll just press and hold again and swing it to my right and release. So in this, with the upper jaw, there is an option for you to scan the intraoral cavity, the impression, or the denture. For tonight, we're going to scan the denture, so I'm going to choose the denture. And if you want some guidance on how to scan, what is the recommendation of 3Shape to scan the denture, you can always click on the button and there would be the guidance of how to scan the denture. Okay. And now I'm going to start scanning. So we're now in the intaglio surface. As you can see, I'm taking my time scanning. It's totally different when there's a teeth present in the patient's mouth.
I'm going to interject a little bit here while you're scanning, Ben. And I think Brenda mentioned it earlier as far as the color of the impression material that you use. So in this case, the heavier body was pink, and that's where like the border molding was done with the heavier body, with the light body as the yellow or gold tone. We have found that blue and green impression material colors actually scan a little faster. It picks up a little quicker. So just a mental note to keep that in mind as well.
Also, I'm going to add in here too, while Bannister's scanning, don't worry so much about the count. I know that for crown and bridge for restorative, that you kind of keep an eye on that because you want a lower number. And this, it's not going to stop on you. So it just takes longer to process. So a lot of times this will spin around for a while. Isn't that correct, Benister?
Yes.
So, and he'll go over that. Thank you.
So as you can see, the software is like processing the scan, preparing the model. And once this is done, we can proceed with the scan of the bite. So what you want to do is ask the patient to wear the denture again and have them bite give you a normal bite. So again, for a full arch scan, there's a recommendation of 2 bites. Okay. Actually, I don't really want to say it as a recommendation. I always say it as a mandatory because if you want to level your bite the right way or to register the actual bite of the patient. And there is an option always to be able to manually align the teeth. So just identify the same tooth and then it will merge. Once it merges, it will process and fix the bite. And then you click on accept and then take the bite again for the second time on the other side. Do you hear that chime? You're good to go. Sorry for the log. We're using a TeamViewer to connect to my TRIOS laptop. So there's a slight log, but as you can hear the chime, it's just a delay on the transmission of the scan to the Zoom meeting. So there, you're going to be able to see that you got registered the bite of the patient. And now you can send this to the laboratory. So what you want to do is post-process it. And then after you post-process, you can send it. Now, there's a question that what if I want also to scan the patient's oral cavity, okay, the edentulous area? You can always scan the edentulous area, the edentulous scan, and submit it separately from the denture scan. And when the laboratory received both cases, they could merge. They have the ability, the software of the 3Shape has the ability to merge the edentulous scan and the denture scan. Okay. So this is, that page is actually the specific motion, which we're not going to do it for this case. So this is the post-processing page. And then you have the insertion direction, the clearance, and annotation. The annotation is nice if you want to add some notes. Like you just click on one area and then you can type whatever you want to give additional notes to the technician. And then once you post-process, it will take probably like around a minute with this particular case that we did. And then after that, there is a way for you to save the scan stream. Okay, that is where you need to go back to the prescription form, open up the case, right click on your mouse, and you're going to see the, I'm going to show it to you after this post-processing. Is there any
question? I don't see any questions in the chat box right now, but I had a question. If you're struggling on acquiring data on the intaglio of the denture, as a for instance, can you still use the zoom feature to just pinpoint on that particular area with greater success without over scanning everything else?
You can always use the zoom. As of now, I think there's an issue with the 3Shape. They're trying to develop it and trying to fix the zoom. Since we're scanning tissue, when you zoom it in, the software is a little bit struggling identifying the area where you want to scan. So remember, the tissue is always, it always looks the same. And then when you zoom it in, there would be more, it's not clear for the software to identify since they're all looks the same.
Thanks.
And I would like to add that if you want to open up the video on the bite, if you had a wax block or even the old Duralay area, you could place that in the area and then scan the bite that way also. It will look like it's open when you send it, except where those areas of the block, but it will show us how much you want to open up that vertical dimension.
Okay. So I'm just going to look at, for this case again, this is what I was mentioning about the how to protect your scan. You just right click or click on that 3 dots and then it put a check mark on protect from cleanup. Okay. So this is also, you can also use this protect from cleanup with other cases like for crowns. There's one doctor that called me and asked me that why did the laboratory couldn't see the scan, but they could see like a picture. So that means that they didn't post process it, and also they didn't protect from cleanup. So they didn't submit it right away. So they waited for, I think it's like 45 days for 3Shape to be able to take out the scan stream. So it's better to protect from cleanup if you think that you're going to be able to use the same scan. But for me, I always say that if it's like 2 weeks old scan, I'm going to scan the patient again as I see them again. So let's see.
Ben, there is a question from Robert, and it was inquiring what exactly you just scanned. So that was a wash impression inside of an existing denture to make a new one. And what we have found statistically is 1 out of 10 patients does not have an existing denture. Anytime you can scan either a wash impression or a chairside soft reline inside of an existing denture, think of that existing denture as like a custom tray. If you're struggling at scanning the intraoral cavity, then this wash impression or chairside reline is your next best go-to. And we've probably had better success actually from these washed impressions. We call them a reference denture versus intraoral scans. you need to be very, very slow and methodical in acquiring the intraoral scan, and that can be quite challenging for some people. I hope that answered your question, Robert.
And also scanning the patient, edentulous patient, it's very tricky. You cannot retract the cheek much. So all you need to do is just use the tip and squeeze it there and try to use the tip to retract the cheek while you're scanning, and let the cheek hang onto the tip, and that's going to actually help you scan properly inside the patient's mouth.
And the reason you don't want to really retract the lips and cheeks a lot is because you're going to change the vestibular muscles, right? So it's not going to be an accurate representation then of what you the denture to be. Now, if you're doing the reference denture, like Bannister just scanned for us, when you put the heavy body and light body impression material in the denture and you insert it, you're going to have the patient do their AEIOU, you know, all of their, you know, things you would normally do for border molding to help acquire their specific muscles and anatomical landmarks for fabrication.
And then I'm going to add a little bit too. I like, if I do scan an edentulous person, if they're a gagger, it is a great way to start for a custom tray, right? So that way you're not using as much material when the custom tray is in to do this technique. But you have to go slow, methodical on a edentulous. There have been times that I've put like dots of flowable with, you know, one dot, one little line, one dot. There's times that I've even sprayed with a little bit of occlude because, you know, that gum tissue, gingival tissue can be so shiny, especially if they've been edentulous for a long time. And, you know, like the older we get, even though the tissue, your mouth dries, the tissue becomes more shiny. And it is a camera, right? Any scanner is a camera, and, you know, you get like almost overexposure. So that's why sometimes it's hard to scan them. But, you know, don't give up. Don't let your scanner become, you know, a paperweight in the corner. You know, just keep at it. You'll get it.
And now we're going to scan for a partial denture. Unfortunately, I don't have any denture for this model, but it's basically the same way as you scan patients' mouth. With what you want to do is just a scan only. You can always do that, or you can always do click on the partial and then click on the upper. You don't really need to submit a design unless you really want to submit, you know, the way you want to design the partial for your case. Again, this one is a metal framework that I'm going to choose, and then let's save, and then forward, click next, or you can also click on the icons here on top. So I'm just going to quickly scan the lower. I'm going to move forward and click next. And then I'll start scanning. This time, I'm going to try to scan from the posterior also. And then slowly move it forward while I'm on the edentulous area. And now once I'm already with the teeth, I can move faster. And then I'm going to scan for the bite.
Ben, do you have any special tips on acquiring the palate?
Acquiring the palate, you can try to scan the palate like as. Hold on, let's go back.
Thanks.
And Bannister, do you find it easier to turn AI on and off in those large span?
So what I usually do is I try to scan it with the AI on first. Now, if the scanner is struggling, that's the time that I'm going to turn it off. But I'm just going to turn it off while I'm scanning the tissue. And then on this particular case, if you're going to notice there's a slight hole there, I'm going to click on the zoom.
Because I always find it easier to scan with the AI on, just like you do. But I do know that, a lot of people, they're told, scan the teeth with the AI on. When you get to the large span area, turn it off. And, I feel like you do, you get a better scan with the AI on because then you don't accidentally get a tongue in there or a finger or,
yes, I agree with you.
or whatever you're holding, correct?
We're a little spoiled now that AI exists and we don't pick up our fingers and tongues anymore, right?
No, right.
Again, I'm just going to turn it upside down. And then I'm going to click scan the opposite side. Yeah.
I did hear that one come together, Bannister.
Yes, there's a log with the team viewer on and connected to the Zoom. So specific motion, I'll try to show it to you, the specific motion. So basically I'm going to place my scanner on the same area where I placed and took the bite on this area where the blue is. Okay, and then I'm going to ask the patient to gradual, like slowly open, tap, 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 lateral movement. In that way, when the laboratory makes sure denture, it's going to be free of any hard contact while in masturbation. So it's hard for me to do a lateral movement on the model, but you can imagine the when you ask the patient to slightly move their mouth, there would be showing the clearance. I'm going to show it to you on this view if it's going to show any contacts. So you can always place it this way, and you're going to be able to see how the patient move their mouth, their jaw, and this is going to help the laboratory in making your denture and how to adjust their contacts. Okay.
Yes, and I know that this feature isn't just for, and I know this webinar is for edentulous, for dentures and partials, right? But I love this feature, especially doing anterior crowns, because it shows, or if the patient is in crossbite, right?
So again, now we're waiting for the post-process scan. There's a lot of question being asked if there's a way for you to submit a case without the post-processing. It's a no. It's a even though we jump to this icon where there's the two people, when you click on the send, it will still post-process and then eventually send to the laboratory. So the nice thing about the post-process is you're going to be able to, the software is going to clean up the scan. It's going to be more crisp, and especially if you're using a shade measurement guide, you're going to see that then almost the natural color of the tooth of the patient. It's being copied. Okay. Now, while we're on this, and if you have any question on how to take a shade measurement, I'll simply jump on it. And I know it's out of the topic, but we're going to, I'm just going to show it to you quickly on how to put the shade measurement guide. So you can always add extra, click, and you can drag it and move it anywhere you want. You can add as many as you want to get the shade measurement.
I find this useful even on an existing denture if they like their shade, especially if they have their regular dentition on the opposite arch, right? Because if the denture was made, many years ago, it could have been the PIN portrait studio teeth.
Or even old porcelain teeth.
Old porcelain teeth.
They don't make anymore.
Exactly.
You're trying to match, yeah.
Yes. So I think it's a very useful feature in that case.
Yes. And again, shade measurement is very subjective. I recommend that you get a second set of eyes to to collaborate with you when it comes to the shade. But I find this 3Shape TRIOS shade measurement guide to be about 95 to 98% accurate, as long as you do your calibration, and then also the light in the room. The room light is going to give a significant shade, you know. So I trained this office. They have a little bit of a darker yellow amber color room light. So when we scan a patient, they have a TRIOS 4 and an iTero 5D. We tried both scanners because I find it like after scanning that the teeth are more towards a pink color. So I tried both scanners and tried scanning and still showing the same. So what we found out is the light in the room contributed to the color and the shading of the teeth.
Yes, and I'm going to add for the post process for those of us that are auxiliary. I like to post process, bring the doctor in so he can check it before it's sent out.
Yes, absolutely.
Our majority of our audience right now is using TRIOS, or they have different?
Well, that's a great question, and that's part of our polling questions. Jessica, anytime you're ready for polling questions, that would be terrific. And I don't see any additional questions from the audience in our chat at this time.
So the first one is loaded up. Oh, do you want to read, Kelly, or do you want me to?
Go ahead. Go ahead.
Poll number 1, do you currently have a TRIOS scanner? Do you currently have a TRIOS scanner? So we're looking for your participation. Right now we've got about 47% of the audience. So if you're out there and you can hear me, we're curious if you have a TRIOS scanner, and that would be a yes or no. I'll give this another couple seconds, and 3, 2, 1. And you're at 46% yes, 54% no.
I wonder if the no is also the numbers of people who doesn't have the scanner. They voted, they chose the no. For those people who doesn't have any scanner, you can always reach out to us. We'll give you our honest opinion about each and every scanner in the market. We're not selling any scanner. So I think we're going to be the best
resource
people to ask, resource to let you, guide you to choose your scanner that would fit your practice.
Mm-hmm.
Absolutely. And poll number 2, this might help based on participation numbers, is for those of y'all who have a scanner, are you already scanning for RPDs or full dentures? And are you scanning for implants? So we're curious for those with scanners. Are you already scanning for RPDs or full dentures? And are you scanning for implants? Oh, we still got about the same percentage answering the question. So I'm going to guess that those that said no to a TRIOS have another model on hand. So I'll end poll really quick. We have 71% that say they are not scanning for RPDs or full dentures, and 75% said they are scanning for implants.
Terrific. Very helpful for us as we develop future educational courses as well.
And then the last poll, for those that have TRIOS, what additional TRIOS training topics are you interested in? Crowns and bridges, implant training, dentures is popping up, partials, and full arch scanning. So we're curious what additional TRIOS training topics would interest you. You know, as Bannister mentioned, and Kelly's probably going to reiterate here shortly, I'm calling them as a resource for scanners. They're a great resource for you in your office team for your training needs.
We actually had a panel discussion. What was that, about 6 weeks ago, I guess.
I
Yeah.
believe so. Yes.
And, you know, I sort of joke, but we really, we're Switzerland, you know, we like all of the scanners. All of the scanners can take a good scan to submit to the lab, but truly depending upon your practice and the need of the practice, can make a difference in which system might be a better fit for you. So we do have a couple questions up here from Robert for the remake in the first denture case. One doesn't need the scan of the edentulous arch. If I'm reading that and hearing it correctly, you're asking if scanning the intaglio and the denture, right, of the denture with the wash impression, if that's adequate and that you don't have to scan intraorally. If that's your question, the answer is yes. And if that's not your question, maybe try to rephrase it. And then I have a question about taking a wash impression for dentures. What is your protocol for taking them, placing just a heavy or light body into the denture, or using both the light and heavy body into the denture, then border molding? So what, and I'll let Bannister and Brenda comment as well. So what my personal experience was the dentist using the heavy body and going along the borders of the denture itself with the heavy body, right? And then separately taking the light body and putting like a smear of it in the center of the palate, and then pressing the whole denture. It was a maxillary denture we were doing, the whole denture into place. Then before the material set, have them do what you would typically do when taking an impression for a denture. You know, I always say the AEIOU, but you know, you might, you know, pull their cheeks out a little bit, you know, and have them do certain muscular movements. What about you, Ben? Do you have any recommendations on that?
Yeah. I'll go with the heavy and a medium. Because of the with the light, if there's any particular area where there's by the vestibule that is like very important for the case, sometimes with the light it's so thin that it's going to create that eventually it's just going to come off. So I like using the medium to add a little bit of the details.
Got it.
Okay, so for me, it depends on how much the inside of the denture has changed, right? So if the denture has been short, I do like to do a rigid material, almost like for your border molding. And so I would do the rigid, try it in, fit it, remove some of the excess, then I do the heavy, and then a light in the mouth, extrude it, put it in. That's how I do mine.
Super. Are we going to cover making a new denture from scratch, and how about an immediate denture? Great question. So what we're learning is demonstrating on an active patient, right? A live human, with the process of scanning for a full denture from scratch is some of the feedback that we're getting. So I anticipate that to be a future course, but not today, as we do not have an edentulous patient here with us today. So that will need to be something that's pre-programmed and perhaps on site at our new education center, that we have some courses in the fall coming up that Brenda's going to tell us about. And then an immediate denture. So an immediate denture is actually pretty easy. You're going to treat that as a full arch scan, right? And you're going to scan the teeth that are remaining, and then note in your prescription notes that this is going to be an immediate denture. Anything to add to that, Ben or Brenda?
Yeah, so then after the patient has healed somewhat, we know immediate dentures, you know, after some of the healing time, they become really loose, right? So as you put your chairside reline in, and that's why I was saying earlier that you can also, if you have a good chairside reline in an immediate denture and the patient has good suction, especially on an upper, go ahead and scan that chairside reline inside of that immediate denture. So then the lab can reline that until they heal fully enough for you to do your definitive denture, or you can use that as your custom tray for your definitive denture.
And then here is one last question, it looks like. I'm sending my RPD cases to NDX. Can I scan the dentition and NDX still make a metal framework for the RPD? Yes.
Yes.
Yes, you should be able to do that without question.
And
if it's like a specific design that you want, you can always reach out to your NDX laboratory and ask them for a design approval, or you can actually take a screenshot of their scan, and then you can draw how you want your framework to be.
And Bannister, what I like about when you showed about the annotations, if you have some receipts, you can point to those areas to let them know that you have your receipts. So then we pay extra attention to those areas, correct?
Yes.
Great, but and did you have anything else from a scanning perspective?
Just to add to it, if you after post-processing and you still need to scan a specific area, like let's say this green colors, those green colors means that they are holes, but the software was able to patch it up. Now, if you want to make sure that you have the right interproximal walls and you want to have it scanned, you can always go back to the scan page and scan. The only thing is that once you're done scanning, you need to post-process again before sending.
Sorry, I was muted. Great. Okay, we can take Ben's screen down, and Brenda, if you'd like to pull up those last slides. We'll close things up here.
So up next, we did post it inside the chat box. Also, we have an NDX virtual mini academy on predictive restorable solutions. It is a 3-part series being presented by Dennis Urban, CDT. He is our director of clinical education. It is 1 hour each night. You can earn up to 3 CEUs. Starting on Tuesday, August 2nd, Wednesday, August 3rd, and Thursday, August 4th. You do not have to attend all sessions. You can pick and choose which ones you want to be a part of. And then we have 2 live courses coming up in Jupiter, Florida at our NDX Education Center. In October, we have guided surgery and prosthetics for the terminally dented patient and immediate full arch reconstruction. Say that 3 times fast. Presented by Dr. Fasil Qureshi, October 21st and 22nd. And then in November, we have Mark Hyman coming, Cases That Haunt Us. And he's going to review different cases that basically how to how to react, rebound, and recover from clinical failures. And these are his own cases that he's showing basically where he screwed up, honestly, and how he fixed it. So come join him live November 4th.
And as we spoke about our iOS clinical training team, we have extensive chairside experience. And as Kelly said in the beginning, that like Bannister, DDS, Brittany is a RDH, I am CDA, RDA in Michigan, that's expanded with expanded functions, and Kelly is both RDA with a EFDA credentials. So we have trained thousands of people and patients and help doctors, assistants reach their scanning goals and how to scan properly so they can have what we're all looking for, right, is a great patient outcome. Because if the patient's happy, we're all happy.
Thank you. So truly, for that being said, thank you, Bannister. Thank you very much, Brenda. We can't be here without you. So thanks to all of you for attending this evening. And if there's anything additional that you would like to learn about intraoral scanning, digital impressioning, please feel free to reach out to us and we will get the answers for you. Thanks, Jessica, for hosting tonight. You're the best forever.
Thank you, Kelly, being director of the iOS clinical training team of the show. Bannister, Brenda, it is always great to see you on our virtual presentations, especially seeing, your knowledge. Audience, they do this day in and day out, and they would love to help you too. So thank you for joining us. We look forward to seeing you soon. And I'm sure Kelly's jumping off of this and gearing up for the next content to bring to you.